Despite growing recognition that ocean warming has profound implications for human health, our scientific understanding of these links remains fragmented and incomplete. Researchers have documented a number of pathways: extreme heat waves, marine heat waves, altered precipitation patterns, declining fisheries, waterborne disease proliferation, and food insecurity. But many critical gaps remain, limiting the ability of public health authorities to anticipate, prepare for, and mitigate climate-driven health risks. Addressing these gaps is urgent. Without targeted research, communities will continue to face preventable illness and mortality. Health systems will be overwhelmed, and adaptation strategies may be misdirected or inadequate. One key area where knowledge is limited is the precise timing, intensity, and predictability of ocean heat release events and their translation into terrestrial heat waves. While climate models capture long-term warming trends, sudden pulses of ocean-stored heat, so-called ocean heat bursts, are poorly forecasted. The mechanisms that trigger these rapid heat releases, such as shifts in currents or sudden stratification changes, are still not fully understood. This uncertainty constrains public health preparedness because agencies cannot reliably predict when and where extreme heat events will strike. Filling this gap requires high-resolution ocean monitoring, improved coupling between oceanographic and atmospheric models, and integration of these forecasts into public health early warning systems. Another major gap is quantifying the health burden of ocean-driven heat events beyond direct heat-related illnesses. While heat stroke, dehydration, and cardiovascular stress are relatively well characterized, the secondary effects, malnutrition due to crop failure, disruption of fisheries, waterborne disease outbreaks, and mental health strain, are far less systematically documented. The lack of long-term epidemiological studies linking marine heat waves to food insecurity, micronutrient deficiency, or infectious disease incidents limits the ability of policymakers to design effective interventions. More research is needed on these indirect pathways, including region-specific assessments, because impacts vary widely by geography, infrastructure, and socioeconomic conditions. Vulnerable populations are particularly understudied. Children, the elderly, pregnant women, outdoor laborers, and residents of informal settlements are recognized as high-risk groups, but detailed, longitudinal data on their exposure, adaptive capacity, and health outcomes are scarce. There is a need for targeted studies that track how repeated ocean-driven heat events affect these populations over time, both physically and psychologically. Mental health consequences, including chronic stress, anxiety, and trauma, remain particularly underexplored, despite evidence that repeated climate shocks erode community resilience and exacerbate inequities. Interactions between ocean warming and other environmental stressors also remain poorly understood. For example, heat waves coinciding with air pollution spikes, droughts, or extreme rainfall events can multiply health risks, yet few studies have examined these compound exposures in real-world settings. Similarly, the influence of ocean-driven climate variability on disease vectors, pathogen proliferation, and foodborne illness requires more systematic investigation. Understanding these interactions is essential to prioritize interventions and anticipate cascading effects that can overwhelm health systems. Data gaps extend to the healthcare system itself. Research is limited on how hospitals, clinics, and emergency services respond to ocean-driven heat events, particularly in low- and middle-income countries. Questions about optimal staffing, resource allocation, early warning integration, and post-event recovery remain largely unanswered. Evidence-based guidance on preparing healthcare infrastructure for repeated extreme heat events, including cooling systems, water supply, and medical supply chains, is urgently needed. Another priority is the economic and social dimension of ocean heat impacts on health. Quantifying the hidden costs, rising healthcare expenditures, lost productivity, malnutrition, and social disruption is critical to mobilize policy and funding. Current economic models often treat climate impacts and health outcomes separately, underestimating the systemic burden on communities and governments. Integrated analyses combining oceanographic, epidemiological, and socioeconomic data would provide more accurate projections, enabling targeted mitigation and adaptation strategies. Finally, there is a gap in translating scientific knowledge into actionable public health strategies. Even where risk pathways are documented, guidance for clinicians, public health officials, and local communities is often fragmented or generalized. Research is needed on effective communication of ocean-driven heat risks, culturally appropriate interventions, and community engagement strategies that reduce vulnerability while enhancing resilience. Pilot programs and implementation science can help determine which adaptation measures are both practical and effective in diverse settings. In summary, the current scientific landscape reveals both clear evidence of ocean warming as a driver of human health risk and substantial unknowns that hinder proactive response. Key research priorities include improving predictive models of sudden ocean heat release, quantifying direct and indirect health impacts across regions and populations, examining mental health, nutrition, and disease vector pathways, assessing healthcare system resilience, evaluating economic and social costs, and developing actionable, evidence-based interventions. Without urgent attention to these gaps, communities will remain exposed to preventable harm, health systems will continue to be strained, and the human toll of ocean-driven climate change will escalate. The warning is unambiguous. Understanding and addressing the health consequences of ocean heat is not optional. It is a critical step in safeguarding lives, social stability, and global health security.